Good afternoon, and thank you everyone for joining us today. My name is Sarah Namazi. I'm an assistant professor at Springfield College. I'm also a research affiliate with the Center for the Promotion of Health in the New England Workplace, or CPH-NEW. I'm pleased to be invited here today to host this presentation and to introduce our speakers for the CPH-NEW quarterly webinar series on trends in total worker health. CPH-NEW is one of the 10 centers of excellence for total worker health research, funded by the National Institute for Occupational Safety and Health, or NIOSH. Our center is jointly located at the University of Connecticut and the University of Massachusetts Lowell, and we host a range of educational and networking opportunities for researchers in occupational health. So be sure to follow CPH-NEW's social media to be notified first. CPH-NEW launched the first installment of the quarterly Total Worker Health Trends webinar series in March of 2022, and that's consisted of presentations on a variety of emerging topics, focusing on total worker health research and practice. Today's webinar will cover a range of resources focused on addressing both stress and trauma in corrections, presented by three leading professionals and long-term researchers for CPH-NEW. So what I would like to do next is introduce our speakers. So first we have Dr. Mazen El Ghaziri. Dr. Mazen El Ghaziri is an associate professor and associate chair at the Susan and Alan Solomont School of Nursing in the Zuckerberg College of Health Sciences at UMass Lowell. Dr. El Ghaziri earned his Ph.D. at the University of Maryland. His research focuses on occupational health and wellness, with a particular focus on workplace violence in the correctional environment and the healthcare workforce. His key goal within this area of research is centered on opportunities for primary and secondary prevention using participatory total worker health approaches. Joining Dr. El Ghaziri is Dr. Elisa Jaeger. Dr. Jaeger is an associate professor of occupational science and occupational therapy at the Doisy College of Health Sciences at St. Louis University. She earned her Ph.D. in public health studies and behavioral health sciences and health education at St. Louis University. Her research focuses on application of occupational science principles and total worker health strategies for workplace health protection and health promotion, prevention of incarceration, and community transition and integration of individuals with a history of justice setting involvement. And last but not least is Dr. Martin Cherniak. Dr. Cherniak is an occupational health physician from the Division of Occupational and Environmental Medicine at UConn Health, as well as one of the founding co-directors of CPH-NEW, and more recently, the primary investigator of CPH-NEW's Health Improvement Through Employee Control Study, also known as HITECH. So Dr. El Ghaziri, Dr. Jaeger, Dr. Cherniak, I will hand things over to you.
Hi, everyone. Thanks for joining us. So we're going to be talking about a variety of topics today based on our project with the National Institute of Corrections. And to kind of get us started, thank you so much for sharing your job title and your interest in today's webinar. It appears that we have a nice variety of participants today, so thank you for sharing that. And feel free to network amongst each other as well within the chat while you're here today. So our project team includes the correctional program specialist with the National Institute of Corrections, Belinda Stewart and Dr. Dina Owens. And then our research team includes Dr. Mazen El Ghaziri, myself, Dr. Martin Cherniak, and Dr. Pam Fallon, who recently defended her dissertation successfully. So welcome to the team as a new doctor, Dr. Fallon. So today's webinar topics include a variety of areas. We're going to be talking about the definitions that we designed or developed during our project to approach staff trauma and organizational stress. Then we're going to follow that with a background on corrections officer health and well-being, and then provide an overview of this project that started in 2020 and has been ongoing with the NIC. Then we'll present some of the evidence, some of our findings, to discuss a scoping literature review. What is the best evidence that we could find to support resources to address stress and trauma among correctional workforces? And then in the last section of this webinar, we'll be discussing actions to take and future directions to consider addressing the wide gap that exists in available and evidence-based resources. And then we'll open it up to Q&A. So we want to acknowledge that it is Correctional Workers Week. And so we want to recognize all of those public safety workers who are in jails and prisons and serving the community in that space, keeping us safe and so on. And so we appreciate your service if you're in corrections, and to those not on the call today, we just want to acknowledge the work of this very important workforce, and especially note that it is Correctional Workers Week. So who are correctional workers? Well, this includes a wide array of people, and we want to note that it's challenging to put a number on how many people are in this workforce, because there are different ways that groups are serving jails and prisons, from healthcare workers who might be in a private entity, but serving in that space, or who might be hired directly by facilities. So we don't have a really strong count on how many workers there are in the space, and we anticipate that these numbers are slightly low. But it does include healthcare providers, teachers, vocational instructors, chaplains, counselors, and many more. And within those numbers, we know that correctional officers, those people on the front lines keeping the security of facilities, are in about the 400,000 range. And then probation or parole officers, there's about 94,000 of them. And then we also have many medical health professionals, including registered nurses. And then we have the educational teams, such as teachers and learning specialists. So in terms of this project, there were a couple of definitions that we needed to move forward. And I want to note that when we talk about trauma, and the different types of trauma, those include critical incidents and those things that a person may experience. They may be violent, they can be trauma-inducing, and they can lead to challenges with mental health, depression, burnout, PTSD, and so on. So staff trauma can be a deeply distressing or disturbing experience, such as directly when someone is involved with an altercation. There may be an attempt to physical harm. They can be assaults and threats to individuals. And then it's important to note indirect traumas as well. And so that could be when an administrative professional is looking through charts or seeing a report on the things that are happening within the facility, or a person's report, what happened prior to their move to a facility. And so it's reviewing those materials and that written information, photos, and being in debriefings and seeing or hearing those incident reports. So we know that organizational stress is also related to the nature of the job, a person's role within the organization, and then it can include support and rewards at work, the organizational structure, and the work climate.
Lisa, I'll take over for just a few things.
Great.
So one of the questions that we have is, and I have to say, I'm speaking in Connecticut, where we've been working in a participatory format for the last 17 years, and with significant progress. And we've seen a lot of things work and not work. So I'm going to refer to some of that. One of the major issues is the time and coverage issue. And it's easy enough to say that if time is not covered and coverage isn't made available, people will not be able to participate very effectively. And that's always been very central as to what we've tried to work with, because it's a major barrier. The other important issue is we see, and this now is perhaps better reflected in the national climate, there's been a strong emphasis on mental health and substance abuse problems. Increasingly, that's been developed and serviced in a peer format, but there's a great deal of caution about it. in terms of job security, not the least of which is then in areas of law enforcement and custody. Substance use may in fact be a reason for termination. And then another issue that we have is the suspicion about confidentiality. And this obviously has to do with personal health information and its impact on employment. But there's something deeper that goes on in corrections, which also has to do with the basic sense of self-protection and privacy. And it's not always completely perceived. The stigma issues are getting a great deal of attention. We're also recognizing that we don't have the best tools to measure stigma. And what we're seeing is that in our responses that many of the officers in particular have very much internalized the external stigma of corrections work. There's a huge difference and in terms of staffing, availability around the country, and also in compensation, and particularly around health and retirement benefits. They're well known, and almost always because prisons operate in a deficit situation with their states. These items are usually off the table. We have an issue which is one that just has to be worked through, which is that there's a general suspicion among much of the staff that the people who participate in things like health and safety committees or wellness committees are interested more for the purposes of promotion, but not necessarily in terms of having an outlook which is geared towards coworkers. And the other thing, we have to consider, and I think there's a lot of skepticism and even sometimes cynicism around this, is that staff engagement and engagement with the workforce is a commitment that's acknowledged almost universally right now, and that's really changed in the last several years. But it's not really practiced very effectively, and it's sort of absence, and that again is a reason for cynicism, and people look beyond the language. Please make it the next slide. So this is rather crowded. So let me, it's really 2 slides. So I want to talk a little about our experience in Connecticut over the past now 17 years. When we started in 2006, just to be clear, we're dealing with an extremely morbid population. Hypertension at 19%, clinical depression at 31%, overweight and obesity at 83%, no exercise at all in leisure in more than half. And the other thing that we see is that these adverse health effects appear in the first 2 to 5 years of employment. And, these are the precursors of chronic diseases. There really are a couple of questions with this, and I'm going to leave off the right side of the slide, which is repetitive for now. Questions which we have to think, and you'll see some answers and some suggestions throughout the rest of this talk. Are corrections officers really disinterested or detached about their own health? Are they discouraged? Are they actively discouraged? And then there's a mechanistic question. Can we improve health as long as pay is low, hours are long, and turnover is high? And I think you can anticipate our answers to that, but you will see some evidence. And we don't want to lose track of the fact that we have mechanical issues. And, to take an example, because we're looking at multiple states, if a corrections officer in St. Louis is paid half of what a corrections officer, or even less, is in Connecticut, this has a great deal to do with turnover and longevity on the job. In fact, we find many of these issues that are seen as crisis issues are resolvable, but other issues are not. Why don't we go on?
Okay, good afternoon, everyone, and thank you, Bryan, again for joining us. I'm gonna present in the coming few slides some of the models that frame the work that we've been doing. So as we were navigating our project and towards the end of 2022, in October in particular, the US Surgeon General released a framework for workplace mental health and well-being. And this framework, as we see from the picture over here, it is centered on 5 essentials around which the worker voice and equity are centered, and as will be demonstrated in this video that I'm going to show in a minute.
America is a country that works. More than 160 million people are part of our workforce today. Work provides us with so many benefits, but workers also say they are worried, stressed, and struggling. For 84% of workers, workplace conditions have contributed to at least one mental health challenge. 81% say they will look for workplaces that support mental health in the future. The most important asset in any organization is the people. So as we recover from the pandemic, leaders across organizations, together with workers, have the opportunity to reinvest in the mental health and well-being of our nation's workforce. The Surgeon General's framework on workplace mental health and well-being is a guide for leaders and workers built on the best of public health science. The framework has 5 essentials. Protection from harm provides physical and psychological safety for mental health and for well-being, while security ensures financial and job security. Connection and community is about fostering the interactions and relationships we need for social support and belonging. Work-life harmony gives us the ability to better manage demands in and outside of work through autonomy and flexibility. Mattering at work is about knowing we are valued and that our work makes a difference. It gives us dignity and meaning, no matter what our role. An opportunity for growth keeps us growing professionally, socially, and emotionally through learning and accomplishment. These 5 essentials, knit together, will help our workplaces become engines for mental health and well-being. To access the framework and resources, visit surgeongeneral.gov/workplace.
So as we've seen in that video, our project has been heavily aligned with the tenets of these model and centering around the worker voice. At this stage, I would like to ask the group here who's in attendance with us, in terms of how are you able to give input at your organization, or how are the voices heard throughout your organization? So if you can take a minute, look at the chat and respond to the poll that's in front of you. Okay, as we've seen here, mostly we have through committees, unions, and I'm gonna be sharing the results in a couple of seconds. So thank you for those participants who responded to the poll. So as you can see here, from the results that we have, almost 44% responded committees, 38% said union, and emails as well, and 50% through surveys. And these are not mutually exclusive, so people could have responded to more than one of these. So thank you for responding to that. So now, the reason for my asking that, we want to reflect and share with you on how we amplified and heard the voices of correctional workers through our project. So when we started this cooperative agreement in 2020 and 2021, we really relied on the National Corrections Collaborative, which was started as an outreach effort through the CPH-NEW, where we held 3 symposia, and some of you on this webinar today might have attended one or at least 2 or 3 of these symposia, the last one that happened in 2019 in Boston. So we relied on this correctional collaborative as a core, and we expanded on it during the lifetime of the project to include 40 participants representing the voices from corrections, whether correctional officers, union representatives, correctional administrators, professional associations, correctional academics and researchers, as well many others. And we're going to share the list of those toward the end of the presentation to acknowledge them. And the NCC represented the voices of corrections nationally in terms of guiding us through the different phases of the project in terms of the strategy for our scoping and literature review that we're going to share the finding with you today, as well in terms of designing the survey, the data collection process, and how to reach to the correctional officers, the administrators, and so on and so forth, as well as analyzing these findings and how to disseminate them and how to make meaningful recommendation that we're going to try through this webinar to unpack more of what are the takeaways and what can we do with these results. So with that in mind, I'd like to guide you as well with 2 frameworks we used in terms of our study and our results. The model on the left side of the screen is a social ecological model, which where staff trauma and organizational stress is affected by the interaction across the different levels, centering around the individual, which can be a correctional officer or correctional worker in this case, and interpersonal interaction with groups, whether supervisors, administrators, or work colleagues, and the organization, whether it's a jail and prison setting within the framework of this project, and the community, whether the general public or the neighborhood, as well the public policy and how it really interplays across all these levels. The model that you see on the right side is the level of prevention that's mostly used in public health as well in other occupational health and other avenues as well, which focuses on 3 levels of prevention. The primary level of prevention, which is the top of this triangle or pyramid, is preventing staff trauma and organizational stress before its occurrence through education and other strategies where we identify the risks and mitigate it and increase the buffers to reduce vulnerabilities in order to prevent its occurrence. At the secondary level of prevention is mostly when we have immediate and effective response to staff trauma and organizational stress, including emergency care and interventions included for the short-term impact mostly, and to reduce the negative long-term impact of any exposure. Last but not least, at the bottom of this pyramid is the tertiary prevention, which is the long-term response or the rehabilitative response when it comes to certain exposure. So given these framings of 2 models that we're going to use to share our results and recommendations throughout this presentation. I would like to point out that we're not going to delve a lot into the details of the results. If you'd like to hear more about the details, we presented those in thorough details through 2 NIC webinars, and the recordings are available on this link, and they will be shared in the chat as well within this webinar. So first, I'm going to share with you the best practices that we identified based on the scoping review that we've done. So we did a scoping review of studies that conducted on stress and trauma within the correctional workforce within the last 20 years using 5 databases. And we identified only out of 1,508 articles that were included based on our inclusion-exclusion criteria, only 25 studies that met those criteria. So within these 25 studies, I want to walk you through different themes and across these 25 studies. So we identified 7 themes. One of the first themes that we identified is need assessment from using CO voices. 3 studies focused on that using teams that performed workplace violence intervention planning as well. 4 studies actually. And another approach was hearing the voices of the CO through participatory engagement, of which teams were formed using healthy workplace participatory intervention and other methods for identifying a health and well-being issue, designing an intervention, implementing it, and evaluate it. The third theme on our scoping review was organizational management and policies related to staff trauma and organizational stress. And these focused mainly on evaluating changes in relation to solitary confinement policies and dignity assault policies, evaluating decision management and decision-making at the unit level within a correctional facility. We identified 2 studies that focused on mental health training in relation to the incarcerated population or residents. And these focused on CO or correctional officers' awareness on mental health issues that affect the residents within the correctional facilities, such as staff harm or self-harm, and they were at the organizational level and use secondary level of prevention. The other themes, one of them identified mental health and health mentoring initiatives at the organizational and interpersonal level when we talk about the social ecological model, as well on the primary level of prevention. And these 6 studies focused mostly on peer mentoring for physical fitness, psychoeducational training, as well as matching mentors to mentees. 5 studies focused on stress reduction techniques in order to address trauma and stress in the workplace, including an array of stress reduction techniques such as mindfulness training, relaxation seminars, and taking break in outdoor spaces. The last 2 studies that we identified through our scoping reviews focused on wellness training, and those were mostly, one of them focused on the exchange and the visit to Scandinavian facilities and looking at their wellness initiatives. And the other study focused on yoga educational offering for individual support through organizational level program for secondary level of intervention. At this stage, and knowing these 25 themes, and before we delve into the results from the survey, I would like to ask you through another poll, what areas does your organization focus on when addressing staff trauma and organizational stress? And as we are waiting for the poll responses, I'll move the mic back to my colleague, Dr. Lisa Jaegers.
Okay, so in terms of survey findings from this national project, I'll kind of go through the process that we took to learn about the resources that exist in jails and prisons across the US. So first, we looked at after these findings were located from the scoping review that Mazen just talked about, we used those findings from the evidence and held multiple meetings with our task force, the National Corrections Collaborative Task Force, and discussed those findings. So if we want to pause for a second, Mazen, I saw the poll pop up. Do we want to go over those?
Yeah, sure. So we have the highest, less than half of the participants said policies, and then that was followed by equally peer support and staff and leadership training. And the least one is 1/3, almost focused on practices when addressing staff trauma and organizational stress.
Okay, excellent. Well, thanks everyone for sharing those commonly used programs in your workplaces. And so as we discussed each of these topic areas, this came out with our task force using that participatory method. And first, policies were considered to inform and govern staff behavior. And typically policies are used to set expectations and guidance for the correctional operation. When we talk about practices, we're thinking about activities that are intended to improve the quality of work. And then peer support programs, we felt were really important to peel apart this sort of onion of different resources and focus specifically on them, because we've heard that many workplaces focus on peer support in workplaces that have high rates of trauma experience. However, there's little evidence in that area to show specifically how are these programs rolled out. What does that, who are the peers? Are they between managers, co-managers? Are they between frontline workers? Are they across the board? And so on. So how are those designed and how are they implemented? And what's the evidence to support that? And then in terms of leadership and training, this was another specific area that came out, and it's intended to address staff trauma and organizational stress through that training. So the last area of this survey gathered workplace and participant demographic characteristics, and we designed the survey to ask specifically about correctional officers' awareness of each resource presented. Did they use it and did they find it helpful? Then we also asked middle managers and senior administrators about the same domains and whether or not they were used at their facility and how each resource fits the needs of the correctional officers. So we analyzed this data and using univariate different descriptive analyses, we'll present some of those findings to you. And we also offered open-ended questions for the correctional officers to share about their satisfaction or dissatisfaction with each resource. And then we conducted thematic analysis of those resources. And so as we mentioned earlier, this project rolled out in 2020, near the end of 2020. So we did find some challenges, of course, launching the project during the pandemic. And so we developed a structured approach for rolling this project out. So the next graphic shows who completed the survey. And basically, well, first of all, we want to say thanks to everyone who did participate. I did see some names of task force members on this call today, so thanks for being here and contributing to this. And for anyone who filled out the survey, we truly appreciate that. A total of 1,371 corrections workers responded to the survey, with 88% representing prison workplaces. There were 40% of respondents were correctional officers, 34% were middle managers, and 11% were senior administrators. And then workers represented 38 states, with 51% from the Midwest and 34% from the South. And there were 14% from the Northeast and a lower representation from the West. Okay, so diving into the results, what did we find? So in this table, we're showing you what level the type of prevention represented was in the resource that was asked about. And then we rank them in order of the highest reported use and awareness. And so the top two rows are those that were reported the most often as being used, and the lower two are the lowest number of percentage use. So here, the commonly used policies were also all at that organizational level and showing a variety of prevention levels. So for correctional officers, the top aware of and used policies were in two main categories. The first relating to trauma response, including reporting trauma classification and response and debriefing. And the other related to work design, such as job descriptions, schedule and overtime, and protected breaks. And so fewer COs were aware of and used policies in the areas of time to de-stress after a traumatic incident and adequate staffing levels. So generally, CO awareness was high, yet there were few reports on the use and helpfulness of these policies. Now, when we talk about the reports from middle managers and senior administrators, we found similar patterns in terms of what they felt was being used in their facilities. So the rank order of these topic areas are the same for middle managers and senior administrators. And so we found that was interesting, that was similar in response. And so, but what we found was that where COs said they were aware of these many things, they also reported that fewer COs found them to be helpful to their needs. And when we looked at a comparison between helpfulness or usefulness by the middle managers and senior administrators, those results were much higher than the perceptions of the correctional officers. So a little bit of a difference there. When we dive into the area of practices, the commonly used practices that were reported by COs were aware of the use of referral to an employee assistance program and internal sharing of positive employee recognition and sharing positive stories of officers and facility activities in the news, health and well-being committee, and having confidential supportive staff discussions. In terms of the lowest ranked aware of and used practices that were found, they focused on equal treatment, a supportive culture, community engagement, and spiritual resources. And again, we found similar patterns between those middle managers and senior administrators. However, again, where the correctional officers were aware of these practices, they did not necessarily find them to be useful or helpful to their needs. And in comparison, the middle managers and COs found them to be more useful and helpful as compared to those COs. Okay, so moving on to those open-ended areas, and we really try to encourage listening, hearing the voices of workers as much as possible. So from those open-ended responses, we learned about areas of dissatisfaction that included organizational areas such as overtime and time off, unused or unclear policies, improving workplace environments, and administration management. There were also dissatisfaction themes on stress, wellness, treatment and trauma, and appreciation or no support. In terms of satisfaction, there were areas expressed at the organization level for policy and resources, accessible management and clear communication, wages and pay, employee assistance program, and inmate protocols. And there were additional areas of satisfaction such as peer support, training and education, and wellness.
Thank you, Lisa. I'm going to present another theme in our survey, which focused on peer support, which has been discussed within the National Corrections Collaborative Project Task Force and in the literature as a promising practice to address staff trauma and organizational stress. Similar to what the pattern that Lisa have seen in policies and practices, similarly, the correctional officers reported high awareness of these top two peer mentoring program or peer support, a staff peer support team to support emotional and mental health, and peer mentoring of new staff. And similarly, the middle managers and senior administrator reported high use and high fit to the needs of the COs for these two programs. However, the COs reported much less use and much less helpfulness in relation to these two top programs. And the lowest two programs when it comes to peer support were freestanding critical incident team and small peer support team with an extended focus around mental health. And as we can see, these programs are within the 3 levels of prevention that we illustrated earlier. And we can see this trend about this like discrepancy between the perceptions of the COs in terms of the usefulness and helpfulness compared to that middle managers and senior administrators when it comes to these like resources. And Pam investigated that very thoroughly. Dr. Fallon, she's with us on the call today as part of her dissertation in terms of the facilitators and barriers to peer support use. Some of the facilitators was the program being available and accessible and being communicated about, the leadership qualities and the training of the middle managers and senior administrator within the facility, and the confidentiality and the trust in the program and in whoever is leading and managing the program, the availability of the time and the staffing to be allow the CO to use this program. And last but not least within this is management support. In terms of the barriers, again, lack of availability, of lack of accessibility or not knowing about these programs, the burden of staffing and time issues to be able to use these programs, lack of trust and confidentiality, which ties very well with stigma, the culture with corrections as well, and the lack of managerial support and training that will allow the middle manager and senior administrator to support the CO to use these resources. Interestingly enough, Pam has done thorough analysis about this, and she's found as well through her analysis that age and years of experience interplay really a lot when it comes to predict the use of such programs by correctional officers. And if you'd like to know more about that, feel free to reach Pam, and she can share her contact through the chat as well to let you know more about the results of her study as part of this project. Last but not least, the last theme within our survey is staff and leadership training. So again, the highest two staff and leadership training for COs, middle manager, and senior administrator, they all aligned across the 4 domains, is staff and education on non-invasive de-escalation defensive techniques training in terms of their awareness from CO perspective, and management and leadership skills training. And however, the COs reported to be aware of these, but less reported on the usefulness and how much they were helpful for them. However, the middle manager and senior administrator reported much higher ranking and frequency of these two compared to the COs, again, showing the discrepancy in their perception. And the least two within this list of leadership and staff training was trauma-informed care and trauma or critical incident seminar. Though anecdotally, through NCC Project Task Force, we've been hearing a lot about how useful these two are, but from the result of the survey, they ranked lower compared to the other staff leadership training programs that are existing. So what are the key findings and takeaways from the project so far? There is generally limited evidence about resources. Only 25 studies were identified in terms of evidence, and these were only related to correctional officers related literature. The 3 levels of preventions were evident and throughout these studies, as well throughout the findings from the survey. And there is an opportunity for us to better address the usefulness and helpfulness and to understand this gap in the awareness of the resources of this for the COs and their perception of how useful or helpful these resources are, and the gap between the perception between CO, middle managers, and senior administrators as well. But how do we take these findings and what do we make out of them for implementation and practice? And that's what we want to spend the rest of the session today. So we shared at the beginning, centering around the worker voice and the worker engagement. So from that perspective, the results support the need for participatory action research approach with total worker health approaches for engaging all levels of management, frontline workers, in terms of the needs assessment and intervention development process, and to provide support for correctional officer input in the design, development, implementation, and evaluation of such resources, and further integrate the participation of COs and managers into the structure of the facility as well. And some examples that can help include offering the time, the meeting location, and allowing the time of shift to be able to attend the meeting. And we recommend that correctional officers explore opportunities to share their feedback, whether through and their voice, whether through their engagement or through their union involvement. A lot of you shared in the chat, in the poll, that unions were a good vehicle to utilize for the voices of the COs to be amplified and to be heard. And the COs can ask for accountability from their leaders within middle manager or senior administrator regarding the committee achievements and what they can do for the COs as well. In terms of resources and how to address that from awareness, usefulness, as well as helpfulness, there is opportunity here to better address that in terms of having the workforce know across the board of what is existing and the need to continually assess those aspects of any program and not to assume that one size would fit all, and to listen to the COs in terms of what works and what does not work, given the gap in the perception that we've noticed in our findings.
Yeah, so in addition to the actions that Mazen just discussed, we can also think about ways to integrate multiple levels of prevention. So those primary, secondary, tertiary levels that we've talked about and provided examples. We can also think about ways to approach how to tailor the format of presentations and how we deliver resources that address stress and trauma. For instance, the timing of delivery of these resources, working across the different shifts. There's many different shifts in correctional workplaces, and then people who float different shifts. So how can we reach all of those workers, and how can we design these programs, practices, policies, and things to consider how a person can learn about them, how they can roll them out, how they can actually utilize them, and so on. Since many of the jobs in corrections facilities don't have easy access to email or electronic formats of communication, there may be paper post-it boards, in the lunchroom, which is the main way that they're receiving news communication. So we have to be really creative about how to tailor the formats. We can also address and build processes and structures such as staffing structures, adequate pay, the space, the environment, health benefits, and mental health first, supporting that work environment itself. And then there's also many types of peer support that I mentioned earlier in the literature and identified by Dr. Fallon's work. And so that can be for different groups of workers, including coworker support, manager peer support, and social support. We found that a lot of workers typically go straight to social support as their primary area, friends and family of wanting support. That was found in one survey. And then depending on a person's tenure in working in corrections, they may seek more of a peer-to-peer worker-to-worker support. So there's different methods for rolling that out and different ways of designing it. There's also opportunity to improve availability of peer supports for both correctional officers, correctional workers, and managers who may be new in positions. So that transition coming into the workplace, but also for those new leadership roles where someone was a frontline worker, but then now they're moving into a leadership role that they haven't had before. So we think that supporting those individuals to transition into new positions is really key to building great lines of communication, building community, and having that ability to lean on others for help. We also know that it's important to enhance correctional worker accessibility to resources, such as offering and advocating for time to attend training or to join meetings and hear communication. We can also look at the ways of building the way communication or the way resources are communicated. And so that's huge. And reducing those stigmas around mental health are enormous. And having multiple formats, multiple messages, and ways of doing that are important. And then finally, providing and participating in facility-wide forums and time to attend those presentations are some ways to spread those supportive messages. Now, along with the NIC project, we have other ongoing research projects. So this is one that was performed as a pilot where a correctional facility actually came to me and asked, have you looked at diversity, equity, inclusion in your studies, and would you be willing to help us launch our initiatives around creating a more supportive environment? And so based on the findings from this pilot project, we're going to be considering how feeling included and belonging in the workplace can help address resources, because we know that if a person feels excluded, that adds to their stress. It can add to trauma and the other things going on within the workplace. So in this study, there were many suggestions related to workplace diversity, equity, and inclusion. And as you see on the list on the left, what came out from these facility-wide focus groups and interviews is that belonging was the most prominent code group. And so these study results, as you'll see on the next slide, we go back to that model that Mazen showed earlier from the Surgeon General's message, and it considers how mattering at work and connecting and having a community at work is so important. So in that pilot study that I just mentioned, we learned that belonging needs to be especially addressed at management levels and through additional skills training to support communication with workers, linking them to resources, and addressing worker concerns. So it was suggested by a participatory team that mentoring programs can help build management skills and employee participation to potentially improve belonging.
So, thank you, Lisa. And we'd like to acknowledge that the realities and the challenges of the workforce. I mean, staffing concerns, pay, flexibility, benefits, among other, are critical issues. And we do not mean by any way to imply that the participatory engagement efforts and the that we are suggesting is enough on its own. But we do not want to minimize as well the significance of having the worker voice centered in really addressing or designing their concerns when it comes to stress and trauma in the workplace. So given the findings from this project, we have been in communication with the National Institute of Corrections, and we have a proposal for continuation of our work under review currently to expand our understanding of this workforce from an inclusion perspective, where we're extending the once we hear back from the NIC, we'll be extending our identification of resources to address staff trauma and organizational stress to include additional job series that have direct inmate contact beyond the correctional officers. And we propose to conduct that through a scoping review and a national survey, where we'll be including as well jails and prisons, custody and non-custody staff, and with a much like consideration for correction, the other categories that we listed at the beginning of correctional workers in addition to correctional officer. And that's really in line of centering around the worker's voice in the workplace and not like excluding any category of the workforce in the next phase of this work. Furthermore, we'll be interested in characterizing the critical incident as an exposure within the workplace. And we know through the literature and based on our experience with the correctional workforce that there has been variation in identification and the reporting of critical incidents, whether within the same state or across state lines. So previous work that was led by Dr. Jaegers identified that critical incidents being reported or not reported have been having an impact on the CO and other workforce, from lower job satisfaction, higher PTSD, higher work absence, and more low back and spine injuries as well. So given this and its impact, we are trying to further characterize and better understand these critical incidents and workplace violence exposure in this workforce within this continuation of this work with the NIC. Martin?
Yes, I just saw that question come up about custody and non-custody. So really, whether it's prisons or jails, the workforce is largely divided into those who have direct contact with inmates and those who don't. Administrative staff, for example, those who work in workshops, dining halls, staff grounds are considered non-custody. In fact, the line is sometimes not so clear. And for example, with healthcare workers and teachers who play very large roles and have direct contact with inmates. It's an important issue because there's a traditional division in corrections between custody and non-custody. It has some implications for workers' compensation and so forth. But in reality, there's a lot of interest in participatory work in crossing those lines. I wanted to make just a few points about this and leave you with several questions. We had begun our work in Connecticut using basically standard surveys. Some of them have been primarily developed by CPH-NEW, and these clearly proved not to be adequate. When we looked at our responses, we had an extremely healthy, happy workforce. And yet when we used qualitative methods, we did not see that, quite the opposite. And so there was a lot of revisions on these surveys that were done by a number of people on this call on the advisory boards, because we wanted to get closer to accurate responses and to some meaning with all of this. So when we customized, one of the things that we found was that we almost, as I say, almost had opposite results. And one of the considerations going forward is in fact the issues around survey revision. I would add as well that it's important in terms of the current work done in this sense. So we've looked at 3 different populations: senior administration, supervisors, and line officers, custody line officers. And what we found was very large differences in terms of awareness of resources, and particularly in response to trauma and critical incidents, and attitudes about whether programs were present or not. We're not sure those things mean exactly what they seem to mean. One of the things that's happened within high tech, and a number of people on this call have been working in high tech, as we've used iterative techniques of grounded theory to interview people who have worked somewhat or are familiar with the projects, whether they've been in participatory teams or just are familiar. We find that these very large gaps between supervisors and lead administrators have disappeared. And it's important because a large focus right now is on training of more senior people. It's usually on what's the communication problem with the line staff. That's only part of the issue. So we have a few questions which we want to ask, we want to look at going forward. One of them is, in our limited view of morbidity patterns, and also particularly some of the biometrics, looking at multiple facilities, Missouri, Oregon, Connecticut, what we have been seeing is that despite very large differences in the systems, prisoner jail, pay levels, benefits, the physical measurements are remarkably similar. And what we're also seeing in these surveys is that the responses are remarkably similar, independent of the state of the region. And one of the things we feel we need to do is to replicate further to see if that's true. If it turns out to be true, which seems pretty likely, that takes an immense task which we have, which is all the very different systems and the distribution of those systems, and makes the intervention patterns a bit more direct. And so one of these questions that follows this is that the facility itself, because everyone talks about how every place is individuated and different, or the work that predicts survey response. And so far, although it's not going to be a totally positive, negative, yes, no question, it seems to be that it's the work itself that is most predictive of responses. And so the last question really we wanted to be looking at is really for the future. We've got limited intervention research, and we've got quite dramatic results, at least in Connecticut. And so one of the questions we have is, as we move towards increasingly into formats for improving mental health in the workforce, and for improving responses to trauma and understanding the effects of trauma on the individual and on family and even community, will we do better, or is all of the detail really not relevant? And I'll let people think about that, but I think you know what our answer is.
Thank you. Thank you very much, Martin, for these provoking questions. And we would like to acknowledge the NCC Project Task Force member, and thank you all in attendance of today's webinar. And I'll give the mic back to my colleague, Dr. Sarah Namazi.
Thank you, everybody, for joining us. Our next Total Worker Health seminar has been posted. Please be sure to register, and we hope to see you there.